Assalamu alaikum. Welcome, Dr.
Alaikum.
Gilani, to KCF Spotlight Series. It's a privilege to have you with us today. Thank you so much for taking the time out to speak with me, especially on a bright, sunny Saturday morning. I know how much we want to make the most of British summer. So thank you so much for taking the time to speak with me and the KCF audience. Let me begin by briefly introducing myself. My name is Ifra Shah, and I'm a civil servant here in the UK. I work as a senior policy manager for OFGEM. And today I have the privilege of speaking with Dr. Imtiaz, who is a well-accomplished and well-celebrated medical professional here in the UK. Thank you so much for joining us. I have had the privilege of knowing Dr. Gilani ever since I moved to London for my master's at LSE. And Dr. Gilani and his wife, Dr. Alia, became my local guardians, uh, always checked on me, like close family, and now are some of my most favorite people here in the UK. So, welcome again, Dr. Gilani, for the Spotlight series, which showcases Kashmiris who have created an extraordinary impact in their fields.
Yeah, Assalamu alaikum, everyone, and Ifra. It's so great to be part of the series. Always never thought I'll be on the other side of the screen, which is but all the same. Yeah, really grateful, and also it's been and thank you for the kind words actually. And yeah, it's been wonderful, and I'm really, really, really happy to be here.
Great. So let me begin by asking you about your early life in childhood. So you studied medicine in GMC Srinagar and then proceeded with your MS in SKIMS, right? So please share with the audience about your early schooling and what really prompted you to pursue medicine.
You know, as you know, I come from downtown Kashmir. In fact, as downtown as you can get. So from Khanyar, and very humble beginnings. Uh, Came from a very kind of a middle class family, working parents, mom teacher, and dad was a public servant. Had a very normal childhood. Four siblings, my brother and my two sisters, and raised in a joint household with three uncles, lots of kids and lots of cousins. So a very, very normal childhood, especially given the fact this is pre-internet. So yeah, I'm showing my age here. So lots of play, and going back to the days, when world was a lot more innocent, a lot more fun. Even as maybe year five, I'll be out on the road playing. Yeah. Then I started my schooling from a school called Woodland, which was near Badami Bagh Cantonment. I was there till year five. It was an absolute glorious school those days. I don't know how it is now. Lots of kids from army, lots of teachers from the army background. They were absolutely amazing, fantastic teachers. Given almost like was a multicultural school. Lots of kids from outside in the state, from other parts of India.
Yeah.
And then we moved our house, so we moved to Sora, and then I had to change my school to a school not very well known called Standard. And it was interesting. I had made some very good friends there. Once again, this is Kashmir pre-strife, so much more peaceful, much more genteel times, and had a very normal schooling, normal childhood, and then went on to my college from did a year in Bisco actually, which was very, very enjoyable. I did a bit of trekking there, which has always been my passion.
Yeah.
Then went to Gandhi College, which I think is still around. A fantastic college, actually, great teachers, lots of pundit teachers who were absolutely brilliant. And something really serendipitous happened. So I remember very well. It was Eid day, and me and my brother had gone to see our grandmother who was living in Kanyar. So we had to drop, when you come and get the Qurbani meat and all that. So we're going to drop that. She was a frail lady, and she just went into cardiac arrest. I was in year 12 that day, so nowhere near medical school.
Mhm.
So we just started CPR on me and my brother, and miraculous. I think more my brother, because he was already a budding dentist, so he knew a bit more about medicine than I did. So I played a helping hand, and she recovered, which was amazing. She was almost dead. So I thought, "Look, that's great. Look, you can do that." And I thought, it's a great thing to do as a career. And she thought every day would be like that, but so that kind of was the I don't know, the spark, for want of a better word, to go into medicine. And I was so grateful for that, event, because I couldn't have done, I can't think of doing anything else. And it's been an absolute huge privilege to do what I do. And whatever little difference I can make to patients' lives or colleagues, I can't think of any other profession where you can go home. So, look, I probably saved a life today.
Yeah.
You know,
It was really
so
your family, your very lovely grandmother, who motivated you and yeah, prompted you to just start saving lives.
not directly, but I don't.
Friend.
But it just happened that she had a cardiac arrest, and we happened at the right place at the right time,
Yeah.
and yeah, that kind of set it off.
So, you came to UK about 20 years ago, but you're one of the very few people who made an early career decision to move countries, right? The early starters, really. You've cleared various exams for studying medicine in US, UK, UAE. What was the driver? What made UK your home? What is it about UK that you decided that this is the place I want to be?
Okay, I have to be very honest here because I can be either honest or truthful. I can't
Please
be
be
so.
honest.
It's just
We
like,
love that.
I think what Kashmir means to me is flows through my veins. But there's one thing about Kashmir which I find a bit hard. The culture, especially in working place culture, which is not great. Uh, Probably know what I'm talking about. Uh, when I look back at those days, I was just been through my medical school. There was great folks, great teachers, but I think there's something which was amiss about we don't develop great at a personal level. It doesn't prepare you for life. There's much more to life than just medicine or becoming proficient at, I don't know, uh, clinical medicine. There's much more to life than just medicine. And I felt that bit of that domain was lacking. And I found some of the working practice very toxic. Partly probably because I wasn't an angel myself. Probably some of my work ethic wasn't great, and I can openly admit to that. So I needed some inspiration, and always felt travel is education, and likewise, when you go to other cultures, people who being on those journeys before us are a bit more advanced. Let me see what that is like, and obviously heard a lot about England. You know, our most of our textbooks. There's a lot of historical reasons why we know a lot about this country,
Yeah.
and seemed a logical choice to try it first. And I can't. It's not been an easy journey, but I have so much to be grateful about. This country has given me a lot. I'm always a person who's kind of half glass full, an optimist. And I think at a personal level, I don't know about professionally, I probably would have done well even in Kashmir or India for the matter. But as a human being, uh, this place has taught me humility, and it has also taught me not to only look inwards, also become much richer when you interact with people, cultures of all hues. You also, it did help me with some traits which had to be shed off, to be very honest to you. And also, I learned some good things. One about, for example, is respect for law and order, for example. A simple example is, queuing, how you interact, how you communicate, being respectful,
Yeah.
and 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 not creating a toxic workplace. I'm the same person I was in Kashmir, but I think I'm a different person in many ways.
Yeah, I think travel does that to you. When you move countries, it's such a liberating and empowering feeling. You learn a lot when you interact with people. I completely agree with that. But because you mentioned work cultures, uh, if there is one thing that people back home can learn from UK, from y you having spent so many years here, what is one thing that they can inculcate and maybe absorb, try to, improve on?
Uh, there's a lot of stuff. No place is milk and honey. We know that. There are so many things which the West can learn from our cultures. For example, family values, hospitality,
Yeah.
the warmth, the camaraderie, and so forth, and so on. But there's other things. So, for example, one thing which I would really love to be is about uh, uh, letting people flourish by creating workplaces which are civil, which are cultured, which are kind, and where people are not afraid to speak up.
Yeah.
And there's a difference between respect, reverence, and there's a very fine line between that and being completely superficial and almost, I don't know what the right word for that is, almost slavish. I don't know what the right, that's probably a strong term.
Mhm.
Because there's a lot of deference in our cultures to authority,
Yeah.
whether that's at your workplace or that is in life also. How many people can stand up and, you know, in your workplace and say to the department, look, I think we should do this differently. It's almost, boss is almost always right. So that's one bit which would be great. Another thing is which I'm really passionate about, is respect for your nature. Uh, because if you don't respect nature, the nature will not respect you. And it breaks my heart when I go back to Kashmir. You see such a beautiful land, and we literally are assaulting it on a daily basis. You see the Dal Lake. I went to, in fact, last year, I went to the backwaters of Dal Lake. That's probably even more beautiful than the touristic of Dal. So this is, I'm talking about, from the Ranamari side and all that. And I saw such beautiful, water bodies with, all sorts of water lilies and all that. But there was so much rubbish strewn around all the place. And this is us, fellow Kashmiris. We can't blame anybody else for that.
Yeah.
I don't know why that's so hard, or not respecting other people's space. We never queue, and we're probably too chaotic for our own good. Uh, so that kind of order would be ideal, and also treating people with respect, irrespective of what they do. Uh, you know, Here you see, I have a portrait. He probably gets the same kind of regard and respect I would give to my fellow consultant colleague. In fact, uh, I can even name them. There are, portraits I send Christmas cards like I would to my chief exec. So I don't have to suck up to the chief exec. And if the chief exec walks to my workplace, she wouldn't expect me to come to her because I'm probably feeling a little more busier, and she would come down happily, address me on first name basis, and there wouldn't be kind of obviously I wouldn't be jumping around to please her. So that deference is at times toxic, and that's something I don't know how long that will take, but hopefully those things take time. But that's a couple of things I would love for us to take home from places like here.
So I've been here 5 years, but I've also realized all the things that you mentioned, the recognition and appreciation for work that you get here. Uh, nobody is taken for granted, and the respect that everyone has in the society. It doesn't matter what social strata you belong to, what occupations you have, people are going to treat you with a lot of respect and love. And that is something I hold very close to my heart. So thank you for sharing that with us. We'll move to the next question. You currently work as an emergency medicine consultant at William Harvey Hospital. Prior to that, you've served at the ACCS faculty and college tutor at East Kent Hospitals. You've also been the clinical director for acute and emergency care at East Kent Hospitals. You're also the clinical lead at the Trust and the clinical associate director of medical education. These are some very important positions. Can you please share with me what does a day-to-day look like for you, and how do you juggle so many responsibilities?
You know, you know my daughter, so I think they've got a favorite uh, kind of phrase about this. And I have undiagnosed ADHD
Hmm.
because I
Stay
can't
still.
stay still. I had to be busy.
Yeah.
It's good. It's a huge privilege to be busy, in the right ways. I mean, so in work. So yeah, so my days are usually busy, but uh, I also learned to delegate stuff when I can. So I don't do, I have all those roles, but a lot of these are supervisory, kind of a bit managerial, and also so there's a clinical role, there's an education role, there's a bit of managerial role. So all those three are kind of sometimes intertwined, but also have their own kind of domains. So no 2 days are similar. So as you can imagine, I deal with the specialty where even no 2 hours are same. You don't know what's going to come through. So my day will start, on a clinical day with a handover. Well, other than taking the clinical handover, I think one thing which I think I can say with a bit of pride is that I make sure that I look after my staff. So I'll check on them, have they had rest, have they had time to eat. I think my first question to the, for example, night team is, did you guys get breaks? Because, as you probably know better than I do in management, so if you don't care for what they care for, they will never care for what you care for.
Yeah.
So I'm a big proponent of looking after teams, making them feel welcome, making them feel appreciated, and the rest takes care of itself. For example, you know, as my DME role, education role, I don't email people. I will, in fact, become almost like a joke. I go on these, daily marches on all the wards, and I will talk to trainees face to face and find out what are good things and the things which is bothering them, and that has been hugely, hugely effective with regards to getting real-time feedback rather than having that informal email memos and all that. I come off that. I think you have to personalize those roles
Yeah.
and make them very open and also make them accessible. And that's what I do. So other than my clinical work, I'll go on all the wards, talk to doctors, trainees, and find out what's going on. And I think with a good deal of success, I must say, uh, which really pleases me that I'm able to do that and that trainees or my juniors or colleagues feel empowered to speak to me freely, and I'm able to do something about it. And also, also the Trust IT lead, so a lot of IT innovations, etc. Not as an IT person, but giving the clinical input and all that is part of my role also. So that's also been great, and that's something I really want to take back home to Kashmir also. I had offered, because a lot of data is either misplaced, missed, or never recorded in Kashmir because there's so much lines on paper, which is a huge shame. Yeah, maybe someday that will happen.
Uh, Speaking of making people feel seen, valued, and appreciated, like you did, uh, I recently realized that every time I've had the chance to speak to you or meet you, you emphasize on you emphasize on community building, right? You talk about what it means to live a fulfilling life. You talk about creating impact. And my next question basically touches on that. So I know that you have been involved in various charitable and voluntary work in Kashmir. Uh, Tell us something about the work that you've done and why do you feel it's important?
This, hardly surprising. This is very close to my heart. For all the bluster and things I've done in my life, career-wise, the one thing I think which I hope defines me is what I would do or have done for my family, first of all, uh, my friends and the wider community, both here and back home in Kashmir. Not only Kashmir, I got so many colleagues from all parts of India and other countries, and I consider myself a transnational. I don't think I should be pegged down to one community or one nationality. I think I'm a citizen of the world. I think that sounds very cliche, but that's how I see myself. I think there are some traits which are common to all cultures, to all creeds, and that's the language of humanity and
Wow.
association. So yeah, I think one of the things which really helped me understand this was this. It's a very famous Harvard study. I'm sure most of the world might have heard of it. It's the longest observation study for the last 80 years. I think when they basically, long story short, they just followed longitudinally, a cohort of kids from Boston over their lifetime and found out what are the things which keep people happiest and also live longer, fulfilling lives. It wasn't their financial status or education or bank balance or the ECGs or cholesterol. It was how well connected they were with their family and their community. So that's why I always kind of talk about with my kids, my friends. You have to reach out. You have to create bonds. You have to join the dots. And I think a great example of that would be, it's very personal, but I think it's something I would like to share, and people can draw their own conclusions. Uh, uh, a few years back, VMT, Voluntary Medical Trust, is a charity which is run by my friends. These are all doctors, professors in Kashmir, and they run a dialysis center. And at the height of COVID, there was a time in India when you couldn't even buy a concentrator, and I was approached by my colleagues there. Can you help us, get us, maybe fundraiser?
Yeah.
So this is, I think it was 2020 summertime, and it was absolutely was mayhem in India.
Yeah.
So somehow we did, with the grace of Allah, we did collect a good amount of, I think, something like 40,000 pounds in 24 hours. And they were able to get some 33 concentrates from China. And that's great, they were used and so forth and so on. And if, as my beloved mum, whom I lost a couple of years back, when she was unwell with her leukemia, and there was a time in August 22, it was around midnight, and she became very hypoxic. Her oxygen levels dropped dangerously, went to 70. And was looking for a concentrator around that time. And long story short, so I called around, and one of those charities came and deposited 2 big concentrates at my house, and she recovered from that episode. And in the morning, I checked, they were the same concentrators which were donated by the money we had collected a couple of years back. So I don't know, there was a message from Allah that what goes around comes around. So you never know, what you laid, the plant you have put in the ground, a day won't come. It might provide shade to you, your loved ones, and who knows. But you don't have to do it for that reason. You do things fi sabilillah, for the grace of Allah.
Yeah.
But you never know. So I think that's a very, very was a very touching example of how these things work. So we can all have great careers, have those big houses, 5 canals of land in Bhagat and Ishpur and all that. But in the end, on our deathbeds, what we'll cherish most is what we did for our loved ones,
Yeah.
people who are not as privileged as us, and the time we spent with our loved ones. Nothing else will matter. So this is what I learned in my life. Reach out, make friends, and also give something back.
Yeah. What a powerful story. It's the power of giving, really, right? So
True.
anything that you do uh, out of good intentions, when you have good intentions and when you give people, I don't know, it doesn't have to be monetary, right? It can be a kind word, a kind gesture, a warm hug sometimes. It always comes back. Nothing is ever wasted. Allah just sees everything. So, no,
True.
thank you. I know that you're a community leader, and
That almost sounds like Mr. Khan from the BBC sitcom.
so for
Anyway,
everyone in the UK, I know that you are the go-to person for help
it's a huge
whenever
privilege.
anyone needs it. Thank you so much for all the work that you have done and continue to do.
Thank you so much.
You really inspire us. If there is one piece of advice you had to give to the current generation, the future generation who want to make a difference, what would that be?
Uh, I don't know, but there are much more clever people. Everything is on Chat GPT now, but I think there's some things that are not on Chat GPT. I think from the mistakes I made in my life, or I'm old enough to have done a lot of stuff in my life. I think there's one thing I would say is be bold, uh, come out of comfort zones, and most importantly, you know, right, learn how to communicate, right?
Mhm.
And the sign of a brilliant man is he makes man or woman is they make others feel brilliant, right? So a simple thing, is just learn to know people's names, look in the eye, talk the person in the train, have that courage. You never know what might come out. You never know. I can use so many examples. I can
I love that. Yeah.
the serendipity, just because I had a conversation with this person on a plane led to this, that, and that. Likewise, you never know. I remember with my best friend went to Greece a couple of years back, and I always chat to people. It's famous. The cabbies you don't need to because they'll chat anyways. But there's this guy in the Uber cab, and I found out in those 15 minutes I know about his kids and all that. He's in England and all that, and we got very friendly. And it turns out I left my phone there. Oh, what the hell? This guy came all the way back from goodness me from 30 miles away and give that phone back to me with a smile because he knew the hotel and where I was and all that with a smile, and he didn't take any money from me. So I said, this small gesture, So so long story short, uh, don't be shy, talk to people, reach out, and there's always something which will come out of that. And be kind,
Yeah.
be courteous. The rest will take care of itself.
That's beautiful advice, Dr. Imtiaz. Thank you so much for sharing that with us. Now I'll take you back to Kashmir. I know we cannot stop talking about Kashmir, and I know how much you love going on hikes, how much you enjoy trekking. So I've heard that you've led the Trans-Himalayan Winter Trekking Expedition. You've also climbed the Mahadev Peak and participated in a hiking expedition to Khardungla. These are remarkable hobbies and accomplishments of you as an athlete. Please tell us about this aspect of your life. Uh, I'm sure you miss Kashmir, not only because you have family and friends there, but also because of the beautiful, glorious mountains that we have.
Yeah, anybody can tell what Kashmir means to me. I'm sure you know that. I think sometimes when I feel that way, I just close my eyes. I just want to smell Kashmir, when that after a hot, sunny day, the rain falls, and that I can't even describe that fragrance which comes from that hot soil.
Yeah.
The mountains, the brooks, and everything else. I think one of my favorite trips was many years back when I was on a shoestring budget and went to Leh and made a friend there, stayed in a Ladakhi family, and we went on this, had a bike, went all the way to Kardunga without taking permission from the army, which was crazy because we could have been jailed. But it was amazing. I think one of the places on the way from Srinagar to Ladakh, it's called Lamayuru. Yes, I don't know if you've been to Ladakh. This is like, it goes up and down a snaky road. Well, there's absolutely no vegetation at all, not even a blade of grass grows. And when you stand there, you can hear your heartbeat, your breathing, and and then everything falls in kind of into context, how small we are in the whole scheme of things. And, sometimes, we create so many stressors around us and all that, but and then we are just a minuscule part of this whole equation. So that reminds me of being grounded, being at peace with myself, and also how beautiful world is, and more so Kashmir, is so beautiful, so raw. I wish we could look after it. It'd be a shame to destroy it. I see pictures of those glaciers I've been to, Tars and Martha and Kolahai. They just shrunk. They become so tiny. So, in fact, like last couple of years back, I went to, it's called the Three Peaks Challenge in this country.
Yeah.
So me and my friend Raj, he lost his friend to a cardiac issue, and we did a charity kind of a hike for British Heart Foundation. So went to the three tallest peaks in this country. So the Ben Nevis in Scotland, then Scafell Pike in England, and Snowdonia in Wales in 24 hours. So it's quite a logistical nightmare traveling between these three countries and climbing day and night for 24 hours. So I'm really glad because I never thought I would do it, but I did it, and I'm so proud that I could push myself to do that. And it was a great tribute to my mom because mom was a great lover of nature
Yeah.
and all things natural. As I said, could in those peaks felt connected to mom because I think she was looking down at me with pride.
I'm sure. Uh, Dr. Imtiaz, every time I speak to you, I feel like you're such a Sufi at heart. You talk about grounding, you talk about
Like I
how
said,
minuscule we are in the grand scheme of things. There's so much to learn from you. I absolutely love chatting with you. I think there is so much to learn. You constantly inspire others to do
so,
good, feel good. So thank you so much. But before we conclude, there are some things that I want to ask personally, and we can do a very quick rapid fire if that's okay with you.
yeah. Can I skip any question which is a bit discomforting or?
There are no controversial questions. It's going to be
That's fine.
sweet and simple.
Just
Perfect. So my first question is, what is one thing about Kashmir that you miss the most?
the warmth of the people, without a shadow of doubt. So you can walk into any mohalla or the the camaraderie, the hospitality. You go to anybody's house, they absolutely make you feel like royalty. So you can't probably get this anywhere in the world.
That's true. That's true. What is one thing about UK that you love the most?
Uh, I think the fact that they stand for the underdog and how I think it's society still believes in equality and nobody's above the law. That's something really, I think nobody is untouchable, in the right way. So everybody has to be above board. So that's something I love about the society here.
Love that. Uh, my next question is, if your life was a book, how would you title it? What would the name be?
Ah,
Okay, I'm
he
going to
never
give
gave
you
up.
some time.
He never gave up.
I've thought about it myself, and only one thing comes in my mind, and it is kuch ishq kiya, kuch kaam kiya, something like that. But I'll ask
Okay.
you. You tell me.
Uh, So does it have to be something poetic or it can be
No, no,
something prosaic?
anything.
Uh, I think what in Bible be called. He did his best, something like that. I don't
Yeah.
know.
No, that's so good. I love that. Finally, if there is one piece of advice you had to share with the world, what would it be?
Same thing. Would be, you know, reach out and don't be shy. Uh, talk to people, make friends, know people's names. It's that simple.
Amazing. Uh, I just feel like people don't think about all these things much. I mean, it's simple, it's sweet, but also uh, people don't give much attention because people are chasing and running after titles and like the bigger, grander things in life. But this is something that really matters. So thank you so much for sharing that with us. Uh, Thank you so much for joining us. It has been an absolute pleasure speaking with you today. I am sure people back home and everyone who watches this is going to love uh, getting a sneak peek into your life and knowing a bit about you. Thank you so much, Dr. Gilani.
Thank you, Ifra, and thank you, KCF, for this opportunity. I'm absolutely so grateful and also, great honor for me. Thank you so much.
Welcome. Thank you. Take care.
Bye.